Your liver, it does a lot more than you think it does, and liver disease is rising for reasons that go beyond alcohol. From the Norton Thoracic Institute at St. Joseph's Hospital, Dr. Mohanad T Al-Qaisi is here to break down the risks, warning signs, and when it's time to seek expert care. Welcome.
Thank you so much for having me today.
Well, let's start with the basics. Livers, we all have them, but what do they do for us?
Yeah, liver is actually one of the most vital and hard-working organs in the body. It performs a lot of functions. It gets involved in supporting our immune system. It filters toxins. It processes everything we eat and drink, besides stores energy. What's concerning about liver disease that most of the time, these diseases are silent, meaning we don't have symptoms unless there is an advanced damage. What's concerning these days is that there is a rapid rise in liver disease, likely linked to the obesity epidemic. So patients who have diabetes, obesity, and nutritional and metabolic risk factors, these patients are at high risk of developing liver disease. There is a major, this led to a major public epidemic and major public community concern in our community right now.
So when you think of metabolic disorders, you're worried about the heart, the kidneys, but rarely the liver.
Yeah. So if a patient, so the most common thing right now in liver disease is fatty liver, and these can affect, and these can be linked to being overweight, having diabetes or prediabetes, high blood sugar, and high blood sugar, cholesterol, and high blood pressure. These can be linked and associated directly with liver inflammation and fibrosis.
Okay, so if somebody does have liver disease, and you said it's very hard to diagnose because most people aren't experiencing symptoms, so how do they know?
Yeah, so if you have any of these metabolic risk factors, so diabetes, being overweight, any of the metabolic syndrome, and you have never had your liver checked, the conversation to talk to your doctor is right now. You shouldn't wait till you have symptoms because, as I mentioned, it's usually late. And this liver screening is usually very straightforward. You just need to have a simple blood test and sometimes ultrasound to help us find out if there's a liver damage or liver issues.
That was going to be my next question. How do you diagnose this? So a blood test, that's simple. An ultrasound, also simple. And then you can see inflammation, certain blood markers.
Yeah, exactly. So can you see inflammation, the liver look a little bit big, a little fatty, and there are some changes that ultrasound will head us to. And after that, we can do further testing that can help us to put some treatment for our patients. The majority of these patients would benefit from lifestyle modifications. So eating healthy, regular exercise, staying active, controlling blood sugar, maintaining a healthy weight, and limiting processed food and alcohol. All of these lead to less inflammation and less burden on our liver.
Well, I think I know what your answer is going to be to my next question, but for people watching who want to do preventative care, what's the one thing you would tell them to take care of their liver?
So I think the message for my patients on the viewer today is awareness and early action. So because of the obesity epidemic, many of us might have liver disease right now without even us knowing it. Fatty liver affects 1 in 4 Americans in the moment without even us being aware of it. And this, unfortunately, can be the leading cause of these patients needing liver transplant in the future. So early action and prevention and awareness are key nowadays.
Well, if people want to reach you, if they're interested in further testing, what's a good way to get in touch?
Yeah, so we are at St. Joseph Hospital Medical Center, Norton Thoracic Institute. We offer a robust and comprehensive liver program. Anywhere from advanced imaging, minimally invasive testings, different modalities to treat liver disease and liver cancer, to liver transplantation. What's distinctive about us is the team is working collaboratively and support our patients in any possible way. Our transplant team has a multidisciplinary approach. We basically that consists basically of a transplant hepatologist, a transplant surgeons, along with an interventional radiologist and an oncologist. We work tirelessly and collaboratively to take care of our patients and let them navigate and lead them to navigate their care with us.
Thank you so much. Like you said, it's a comprehensive look. And hey, when in doubt, if you think you're having symptoms, of course, check it out now while it's relatively easy to treat. We're going to put all of this information up on our website, cw7az.com. Thank you so much, Doctor.
Thank you so much for having me today.